There have been many viral diseases till now which have been affected the human host. Usually we see that there are many AIDS kind of viruses, cytomegaloviruses, which might result in Epstein-Barr virus infection. And there are many other viruses, but particularly viral hepatitis is a term being suggested when their liver is being affected with hepatotropic viruses. Currently, there have been 5 hepatitis viruses till now which have been identified. And amongst them, hepatitis A is one of the virus. It is also known as infectious virus, and since it appears in an epidemic form as well as sporadic form, it is also known as an epidemic or sporadic form of hepatitis A virus. And it is usually a benign virus. That is, it is only a slowly growing tumor, and which has a self-limiting ability. That is, it reduces upon itself, and it constitutes with an incubation period of 15 to 45 days. And usually this hepatitis A viral infection or infectious hepatitis, it is mostly acquired because through fecal-oral route or otherwise by personal contact with the patient who has already been affected. And it is usually this virus, once it enters a body of the host immune system, it is seen present available in the form of bile, in stool, or otherwise even in blood during incubation period as well as during Preectaric phase. But the viral shedding, that is a release of the virus, it diminishes once the jaundice is into onset. So this is what is about hepatitis A virus. And mostly the hepatitis A virus causes its infectious hepatitis with the help of certain antibodies known as anti-Hbe antibody, which acts against to the immunoglobulin mu, as well as it also has another antibody which works against the immunoglobulin gamma. Once it starts affecting these immunoglobulins, it starts progressing and starts affecting the patient and resulting into a condition known as infectious hepatitis. So there is a picture right side at the bottom which shows that the hepatitis A, which manifests in the icterus of the patient, or otherwise it might also manifest as a condition known as jaundice of the conjunctiva and facial skin, where the patient is showing yellowish color of the sclera as well as conjunctiva. Coming to the hepatitis B, it is also known as serum hepatitis since it is present within the serum, and the incubation period is quite long, which ranges from 30 days to 180 days. And it is usually acquired parenterally, that is either by administration of the IV administration of fluids, or otherwise during blood transfusion or blood products transfusion, or either because of an intimate physical contact with already affected patient. It is the most severe form of illness when compared to the other 5 varieties, and the viral particle, it appears either in 2 forms. One is in the small form and one is in the large form. In the small form, it appears in the form of spheres or otherwise tubules or otherwise in the form of filaments, and they usually measure 22 nanometers in diameter. Coming to the large form of hepatitis B virus particles, they appear only in spear form, and they measure 42 nanometers in diameter. And usually the genomic structure of hepatitis B is of wide range, which consists of numerous 4 types of particular genes. And this gene, the first type of gene, it is the S gene. And this S gene, it constitutes and it encodes that of the hepatitis B surface antigen, which is present on the surface of the hepatitis B virus, and also encodes for the pre-S1 gene as well as pre-S2 genes. These are the genes which usually help in production of the S gene or S plus gene region, which is present within the genome. So this is about the S gene. Coming to the P gene, as the term itself suggests, P gene, it encodes for the polymerase, DNA polymerase, which helps in production of the DNA, similar strands of DNA strands. So this is what is about P gene. Coming to C gene, C gene usually encodes the nucleocapsid of the hepatitis B virus, which can be encoded, which is being abbreviated as hepatitis HBeAg, which encodes for nucleocapsid gene. And coming to the HBC gene, which encodes for the core core of the hepatitis B virus. So this is about the C gene. Coming to the X gene, which encodes for the HBX gene, which is usually involved in transcription transactivation gene. That is, it provides the similar strands of host DNA as well as viral RNA strands, and which helps in further formation and intermingling of these strands and causing the manifestation of the infection. So this is what is about hepatitis B infection. So there is a picture showing the ground glass appearance of the hepatocytes which have been affected by the chronic hepatitis B infection, which gives a glassy surface of the eosinophilic cytoplasm and displaced nucleus to the peripheral, and mostly it has a nucleus which is being pushed towards one side and which is also sometimes compressed, and which is known as pycnotic appearance. Coming to hepatitis C, it is usually the third major category of the hepatitis, and which is acquired mostly during the parenterally during the blood transfusions as well as during blood product transfusions. Even in conditions whereas patients who are undergoing long-term hemodialysis, because of the aluminum which is being used within the hemodialysis condition, which has more prone for this hepatitis C to occur within these patients. Other than that, we also see during parenteral drug administration of patients who have been abused to this parenteral drug abuse conditions, and even in accidental cuts in case of medical field employees such as nurses and doctors who are being exposed accidentally to the patients who have been already suffering from this hepatitis C. They are more prone for this hepatitis C to occur. Clinically, we see that it is milder when compared to the hepatitis B, that is the serum hepatitis viral infection, and it has a higher rate of progression to the chronic hepatitis when compared to the other 4 types of hepatitis. And usually we see that hepatitis C, it consists of a single stranded with an enveloped RNA virus. And usually hepatitis C can be diagnosed based on the presence of serological as well as virological markers within that of the patient who is already being suffered. And we see that there is presence of anti-Hbe antibodies which constitutes the first generation, second generation as well as third generation of antibodies. Other than that, we also see that the patient might also show the presence of hepatitis C virus which acts as an antibody to the RNA strands. Coming to the pathogenesis, how this hepatitis C occurs, it is usually because of the cell-mediated immune mechanisms which are being into progress once a cell virus enters the body, as well as with the help of antiviral cytokines which are being produced by the T lymphocytes. Because of these, this hepatitis C occurs. Coming to hepatitis A, it is usually enterically transmitted virus, and it has a high mortality rate mostly in pregnant women when compared to the otherwise normal individual. In an otherwise normal individual, it is a self-limiting disease. And this hepatitis E virus, it is a single-stranded which shows a non-enveloped virus which can be isolated from bile, liver as well as from stool. The serological markers which show the presence of this hepatitis E, it is the anti-Hbe as well as Hbe RNA antibodies which show that the patient is suffering from hepatitis E. Coming to hepatitis G, it is usually distinct from the foregoing hepatitis viruses, and still there are being studies to confirm this type of virus, and it is usually affected from blood donors or otherwise even from hemodialysis condition, otherwise from co-infection with human immunodeficiency virus syndrome. And this hepatitis G, it is usually a single-stranded RNA virus. Coming to the virus pathogenesis, how a hepatitis virus occurs, it is usually from the hepatitis S surface antigen which is usually acquired 6 weeks after the infection, and it disappears in 3 to 6 months once the infection has been established. And if suppose it persists for more than 6 months, then it implies that the patient is considered to be in a carrier state, and it indicates that the patient is having acute hepatitis B viral infection. And presence of antibodies to the hepatitis B surface antigen, it implies that the patient has infection for more than 3 months after the onset. And if suppose this antibodies they persist for life, they have a property of persisting throughout the life in such that they have a protection. They protect this hepatitis B protect the patient from hepatitis B reinfection. Coming to hepatitis E antigen, nothing but which encodes for that of the nucleocapsid. It is usually present transiently during the acute attacks with this hepatitis viral infection, and it is if it is present only for 3 to 6 weeks, and if it persists for beyond 10 weeks, then it indicates that patient has a chronic liver disease, and it can progress to a carrier state. Coming to our next antibody, it is an antibody to this nucleocapsid that is anti-Hbe. It usually appears once the anti-Hbe, once the antigen to this nucleocapsid disappears, and it is seen in seroconversion, which is a proper prognostic sign for the infection to resolve completely. Coming to HPC antigen, which codes for the core protein of the viral particle, and is usually detected in the nuclei of the hepatocytes, which is usually seen in the carrier state as well as in the chronic hepatitis patients. And antibody to this the core of this hepatitis B or viral hepatitis, it is usually detected in the serum of the acute hepatitis B during the preectoric stage, and usually persists for 4 to 6 months, and it indicates that the patient is recently infected with acute hepatitis B viral infection. Coming to HPV DNA, which is usually a detection in the sensitive index of hepatitis B infection, and is usually seen in chronic viral hepatitis conditions. So there is a pathogens, there is a picture, a diagrammatic representation showing the patient who has been affected with HPV, how the HPV progresses and starts infecting the patient. So once the HPV, the viral particle, starts gains its entrance into the host, it targets first the nucleus. So we see that the HPV, which is encoded as a blue color particle, it is being transported towards the nucleus, where just only the core of the virus, that is the genomic part of the virus, is only being carried to the nucleus of the host human cell, and there it tries to synthesize the DNA strand, which is similar to that of the host individual, with the help of HBX transcription factor. Once this template is being synthesized, that of the viral RNA and the host DNA, then from the nucleus they are being reached extracellularly, that is outside the nucleus within the cytoplasm towards the ribosomes. At the ribosome, these are being arranged into a proper sequence for this further synthesis and for the further progression of this viral particle. From the ribosomes, this template, whichever has been synthesized, the artificial template, whichever has been synthesized, it is being carried with the help of messenger RNA towards to the endoplasmic reticulum, where the proteins are being synthesized, and there they get arranged into a proper sequential pattern, and then once they reach the endoplasmic reticulum, they are being synthesized and they further are released into the other parts of the human host system in the form of HPV particles. And the presence of surface antigen requires the patient is being freshly infected with this hepatitis B viral infection. So this is what explains the pathogenesis in a diagrammatic pattern. Coming to hepatitis D, it is usually an infection with the delta virus, which is usually seen in the nuclei of the hepatocytes in the liver of the patient, and they show presence of hepatitis S antigen, which is positive in these patients, and they developed in concomitant hepatitis B infection. Usually the virus here we see it is a defective virus, for which the hepatitis B virus, it acts as an helper and results in the formation of a condition known as co-infection with the help of HPV infection, which is nothing but serum hepatitis, or otherwise it might also result in superinfection, that is this hepatitis B virus or otherwise delta virus, it superimposes that of the hepatitis B virus or serum hepatitis condition. So this is known as superinfection. And coming to the markers of the hepatitis D, usually we find it HDV presence in the blood as well as in the nuclei of the hepatocytes. This antigen for this hepatitis D can also be found on the blood as well as on the fixed liver tissue specimens. And the antibodies for this hepatitis D, The antibodies for this hepatitis D can also be seen in conditions, that is, an acute condition of hepatitis can also be seen. Usually the pathogenesis, it has a direct cytopathic effect on the hepatocytes. This hepatitis D directly affects the hepatocyte cells and results in the condition of the infection with hepatitis or D or delta virus. Coming to the various features amongst all the 5 types of hepatitis viruses, usually hepatitis A, it is being denoted with HAV, hepatitis B as HPV, hepatitis C as HCV, hepatitis D as HDV, and hepatitis E as HEV. Usually the viral particle in hepatitis A measures 27 nanometers, whereas HBV 42 nanometers and HCV 30 to 60 nanometers. HDV measures 35 to 37 nanometers. HEV, it usually measures 32 to 34 nanometers. Coming to the genome particle, usually hepatitis A constitutes RNA, which is single-stranded and linear in appearance, whereas hepatitis B, it is DNA and single-stranded as well as in double-stranded pattern. HCV, it is RNA, single-stranded as well as linear or otherwise circular pattern. Hepatitis D, it is RNA and constitutes of single-stranded and circular pattern. Hepatitis A, it is RNA, single-stranded as well as linear pattern. Coming to the morphology, HEV is icosahedral and non-enveloped. HBV is double-shaped and enveloped. HCV is enveloped. HDV is also enveloped. HEV is also non-enveloped and icosahedral. Coming to the spread, it is usually hepatitis A, it is spread by fecal-oral route, whereas HBV by parenteral as well as close contact, whereas HCV by parenteral as well as close contact. HDV, it is by parenteral as well as close contact, and hepatitis E, it is usually a waterborne infection. Usually the antigens for HAV, it is a HAV, and whereas for hepatitis B, it is a HBS antigen, HBC antigen, HBE antigen, as well as HBX antigen, that is which codes for surface antigen, core antigen, nucleocapsid antigen, and transcription transactivation antigen. And coming to the HCV, it is usually, we see it is it constitutes of C103, C33C as well as NS5. And coming to the HDV antigen, usually we find hepatitis surface antigen as well as HDV, and whereas for hepatitis E, it is HEV. Coming to the antibodies, it is the anti-HEV, anti-HBS, anti-HBC, anti-HBE, and for HCV, it is anti-HBCV. For HDV, it is anti-HDV, and for HEV, it is anti-HEV. Usually coming to the severity, it is usually HAV is mild, HBV is occasionally severe, whereas HCV, it is usually moderate, and HDV is occasionally severe, and HEV is also mild. Coming to the chronic hepatitis condition, which do not find in hepatitis A, that is in severe hepatitis we do not see, whereas in serum hepatitis we see occasionally, whereas in hepatitis C we see it is commonly seen, and HDV also it is commonly seen, whereas in HEV it is not seen. So coming to the prognosis, usually we see hepatitis A, it has an excellent prognosis, whereas hepatitis B, it has worse prognosis based on its age the patient is affected. Coming to the hepatitis D, it is usually acute good, or otherwise if it is a chronic condition it is poor prognosis, whereas hepatitis E, it shows poor prognosis. Coming to the clinico-pathological spectrum, usually we find it has a various clinical patterns and pathological consequences. It is being classified into 5 types. First is the carrier state, next is the asymptomatic infection state, next is the acute hepatitis, next is the chronic hepatitis, and the last one is fulminant hepatitis, or also known as submassive to massive necrosis. Coming to the carrier state, usually we find 2 types of carriers. One is the asymptomatic healthy carrier, where these patients, they show microscopically, they show the presence of fine granular ground glass as well as eosinophilic cytoplasm, which is nothing but it is represents the surface antigen of the hepatitis virus. And other than that, we also see a asymptomatic carrier with chronic disease in conditions where the patient is associated with chronic hepatitis, as well as cirrhosis of the liver can also be seen. In asymptomatic condition, usually It is detected incidentally, and it is revealed with the help of raised serum transaminases, or otherwise known as antibody detection. Can also help in identification of this asymptomatic phase of viral hepatitis. Coming to the acute hepatitis, it can be classified into incubation period, pre-ectoric period, as well as post-ectoric period. In the incubation period, we find usually the hepatitis A. This incubation period, it lasts for 4 weeks, whereas in hepatitis B, we find it lasts for 10 weeks, whereas in hepatitis D, it lasts for 6 weeks, whereas hepatitis C, it lasts for 7 weeks, hepatitis E, it lasts for 2 to 8 weeks. Coming to the pre-ectoric phase, in this stage, patient usually manifests with the presence of anorexia, nausea, vomiting, fatigue, malaise, low-grade fever, as well as patient might also show elevation of the presence of transaminases, which can be observed in the serum detection. Coming to the ectoric phase, patient usually manifests clinically with the help of jaundice condition, as well as dark colored urine, abdominal discomfort, as well as pruritus can also be seen, and it can be diagnosed based on the presence of deranged liver function tests, as well as presence of and detection of hepatitis antigens as well as antibodies. Coming to the post-ectoric phase, usually it is based on the clinical as well as biochemical recovery in 2 to 12 weeks. Usually this recovery phase, it is known as a recovery phase, which is prolonged in hepatitis B as well as in hepatitis C. In 1% of cases, they might show presence of this condition might progress to fulminant hepatitis, whereas in 5 to 10% of cases, it might progress to chronic hepatitis, whereas otherwise it might completely, condition might resolve and evolution, there might be evolution into the carrier state. So this is about the acute hepatitis. Coming to the morphological features in acute hepatitis, usually we see that the liver, it is slightly enlarged and it might appear soft in consistency and give a greenish coloration. And usually in hepatocellular injury, we see that there is ballooning degeneration as well as formation of Councilman body, or known as astrophil body, as well as there is also dropout necrosis and bridging necrosis can also be seen, which are the characteristic features when there is a hepatocellular injury. Coming to the inflammatory infiltrate, we see that there is mononuclear inflammatory cell infiltration which is seen within the lobules, and these inflammatory cells, they constitute the plasma cells as well as macrophages and certain neutrophils also. There is also Kupffer cell hyperplasia seen, that is, there is increase in the number of Kupffer cells, which is nothing but a reactive hyperplasia. There is also cholestasis which can be seen, which is a biliary stasis, as intracytoplasmic blue pigment granules can also be observed. In the regeneration type, we see that there is lobular disarray and there is regeneration as well as hyperplasia can be seen. And finally, it might result in complete regeneration, that is formation of healing as well as fibrotic scars can also be seen in such conditions. So chronic hepatitis, it is a continuing or relapsing hepatitic disease for which might range from more than 6 months, with symptoms along with the biochemical, serological as well as histopathological given evidence of inflammation as well as necrosis. Majorly the cause for this chronic hepatitis, it is derived from the hepatitis B, C as well as a combined hepatitis B and Delta infection. And other than that, the other non-viral causes, these include if the patient has a chronic alcoholic or otherwise in drug-induced conditions or otherwise in leukoid hepatitis. These could be the etiological causes for chronic hepatitis to occur. And can be classified based on its etiology as well as the hepatitis activity score into HCV, or it can be classified. It can be classified as HCV type when it is 40 to 60%. It can be classified as HBV type when it is 90% in the infants, and if it is in the adults, it's 5%. Whereas it can be classified as HDV, superb infection, or HBV carrier if it is 10 to 40% of hepatitis activity score. So this is chronic hepatitis. Coming to the pathological features, they are similar to that of as seen in the hepatitis B virus as well as hepatitis C viral infection. And other than that, it also includes Piecemeal necrosis. As the term itself suggests, piecemeal means there's a destruction piece by piece. There'll be destruction of the hepatocytes. Other than that, there's also the expanding of the portal ducts tracts can also be seen, as well as derangement of the hepatocytes can also be seen. So this is what is seen in piecemeal necrosis. Coming to the portal tract necrosis, we see that there's expanding of the portal tracts can also be seen, as well as of the sinusoidal spaces can also be seen. Coming to the intralobular lesions, we see that the lesions are formed within the intralobule, that is the hemorrhagic areas can be seen. Other than that, necrotic areas can also be seen within the lobules, where the architecture of the lobules can be damaged. Coming to bridging necrosis, we find that they are fibrotic areas which are being formed as in the form of bridges which connect from portal to portal areas. So these are certain pathological features which we see associated with chronic viral hepatitis. Clinically, they might be varying from mild disease to the fully blown picture of the cirrhosis, and then when suppose a mild chronic hepatitis, we see that it appears as a transaminitis with presence of fatigue as well as malaise and loss of appetite, and can also find features such as mild hepatomegaly, splenomegaly can also be seen. Other than that, associated with it, hepatic tenderness can also be seen. And the laboratory findings include there's prolonged prothrombin time can be seen. Other than that, we also see there's increase in the bilirubin content, and as well as in the globulin content, it also is increased, and there's even elevated alkaline phosphatase levels. And systemic features, we find that there's immune complex vasculitis as well as glomerulonephritis, and cryoglobulinemia can also be found in case of chronic viral hepatitis. Coming to another classification based on the hepatitis score being given by Nodal and Ishak, we find it is being based on neuroinflammatory activity, where the periportal necrosis is being classified into periportal necrosis if there is no necrosis, or otherwise it may range from no necrosis to multilobular necrosis, where a score is being given from 0 to 4. It can be given as intralobular necrosis if there is no necrosis to multilobular necrosis for more than 10 foci of focal necrosis. And it can be given a score of 6 if there is confluent necrosis, that is, it could be a para-acinar or otherwise multi-acinar necrosis. Based on the extent and depth of portal inflammation, it can be given a score from 0 to 4. That is 0, that is no inflammation, to marked portal inflammation. Based on the stage of fibrosis, it can be classified, given a score of 0 to 6. 0, that is no fibrosis, to 6, that is cirrhosis kind of fibrosis. That is based on extent and density of fibrosis. Coming to fulminant fibrosis, which is also known as submassive to massive necrosis. It is the most severe form of acute hepatitis, and it is also rapidly progressive hepatocellular failure can be seen, which might range from submassive necrosis to massive necrosis. Usually it constitutes of viral etiology as well as non-viral etiology. In the viral etiology, it is the hepatitis B virus, hepatitis C virus, hepatitis B virus as well as delta virus, and hepatitis A virus which is being involved. Coming to the non-viral etiology, it is usually because of the drug toxicity can be seen. Coming to the gross features, usually we find the gross specimen of the kidney, whichever is being affected part. It shows muddy red color as well as yellow necrotic regions and presence of bile, which appears green form. In case of submassive necrosis, we see that the entire framework of the collagen reticulin, it is being collapsed, as well as there is also regeneration. Since it's submassive, there is regeneration of this necrotic region. In case of massive necrosis, we see that there is entire necrotic liver lobules can also be seen. Coming to the immunoprophylaxis as well as the hepatitis vaccines. So to prevent hepatitis to occur, there has been proposed as immunoprophylaxis as well as vaccines for hepatitis infection, which might prevent in patients who, such as in healthcare workers who are more prone for hepatitis to occur. It might prevent them from this hepatitis to occur. So there are certain vaccines which have been available, whereas immunoprophylaxis is a condition where people who have been already exposed to this hepatitis B virus can be prevented from further progression of the disease by inducing certain antibodies against these viruses in our body. So for hepatitis A virus, usually patient is advised to take a passive immunization with active immunoglobulin, or otherwise active immunization with killed vaccine. Killed vaccine can be given for patient with hepatitis A virus, whereas in hepatitis B, based on the patient's condition, patient, if it is a health worker, as already explained, who is more prone for hepatitis to occur from already infected patients on usage of instruments or any needle usage. So these patients can be given prophylaxis before an exposure. So such condition is known as pre-exposure prophylaxis, where the patient is suggested to be given a hepatitis vaccine, where an intramuscular injection is given of hepatitis vaccine at a duration of 0, 1 and 6 months of period. So this is what is pre-exposure prophylaxis. Coming to post-exposure prophylaxis, patient who has been an unvaccinated patient who has been exposed to this hepatitis, usually this patient is being suggested to give a hepatitis immunoglobulin vaccine as well as hepatitis B vaccine. Coming to hepatitis D, this can be prevented also with hepatitis B vaccine, whereas currently for hepatitis C there is not yet any antibodies or vaccines being come into existence, but there have been certain trials where hepatitis B is only being used against this hepatitis C vaccine. For hepatitis E, it's not yet any vaccine is being yet developed. So this is about the immunoprophylaxis and hepatitis vaccine.